What is the difference from exosomes and stem cells?
Stem cells work through exosomes, and exosomes are the ones that do the healing.
We see it in store, we see it on products, but what do they actually do?
Exosomes are extracellular tiny vesicles, and they're usually derived from stem cells. Adipose can be also a source of stem cells, umbilical cord as well. But we, as Anti-Age MD, we're taking our exosomes from the human bone marrow. And we believe this is the source of healing in the body. Whenever you have a cut or an injury, your human bone marrow, which contains those mesenchymal stem cells, will send those exosomes to the area of injury. This is the natural healing process.
Absolutely.
And when you're applying them topically, this is how you're doing the healing. So the first and most important point is...
Today we're going beneath the surface to explore how your skin communicates, heals, and regenerates. It is my pleasure to introduce Lana Yassin. She's a product specialist at Dubimed, and she has a background in biomedical engineering. You've mentioned biosomes, so I want to go and delve into that a little bit more. What are biosomes? Explain what's going on.
All right, this is the most recent advancement in regenerative medicine.
Right.
A lot of people love PRP. I love PRP, but you have to have the right patient to extract the blood from. And this is why I would say biosomes are better than PRP, confidently.
Biosomes really, I think, are going to be the future, as you mentioned.
I agree.
What is the SkinPen, and how does it differ from typical microneedling?
All right, I love this question.
I can tell her face lit up.
So this is the thing.
Today, we're going beneath the surface to explore how your skin communicates, heals, and regenerates. We're talking about the future of skincare. So exosomes, biosomes, stem cells, and how this is redefining how we age gracefully. It's a merge between science and beauty in a way that we've never seen it before. You've probably seen them on labels or in store, but what do these ingredients and technologies actually do? How do they differ from one another? And why are the most advanced treatments now being built around them? So if you're a skincare junkie, skincare professional, or simply want to know what to invest in, this episode is for you. Hi, I'm Summer Kareem, and this is SCINTILLIA After Hours. It is my pleasure to introduce Lana Yassin, who is, first of all, the most gorgeous woman you'll see, porcelain skin. She's a product specialist at Dubimed, and she has a background in biomedical engineering.
Hi, Summer.
Hello, how are you?
I'm good. How are you?
I'm very well. Honestly, I'm not exaggerating. Mashallah, she has porcelain skin.
Thank you so much. I'm very excited to be here.
I'm so excited to have you, and I'm really excited to have this conversation. We've obviously had previous conversations, and I've asked you about 1,000,001 questions to the point you're like, I gotta go now. So I'm excited for everyone to listen and learn, really, because I've learned so much from you.
Perfect. Thank you so much.
Brilliant. Well, the first question is, I wanted to ask, how did you get into this industry?
So basically, I'm working with a company called Dubimed Medical Supplies. So I've been there for about 3 years now. And of course, our company has a very high, like a large portfolio of brands. And one of these brands is Anti-Age. We have SkinPen and various other injectables and skincare products. And this is where I dived in the skincare industry and aesthetic field.
It's so cool, and it's changing so quickly.
It's very fast.
We were just discussing how we've heard about stem cells and exosomes, but this notion of biosomes I hadn't heard of until very recently.
Yeah, we kind of launched them 2 years ago. It's very, very recent.
Yeah, so that's incredible. And the effects of which I'm really excited to delve into.
And you tried them already.
I tried them as well, and I loved the results. I really did. And I'll talk a little bit more about that later, but it was really, really effective.
Perfect.
Yeah, so good. So I'm going to start at the very beginning. I want to talk about exosomes. So we see it in store, we see it on products, but what do they actually do?
Exactly. So it's very important to know what exosomes are in the beginning. Exosomes are extracellular tiny vesicles. So we're talking about the size of 30 to 150 nanometers. They're typically very small, and they're usually derived from stem cells. And it's very important to differentiate about the different types of stem cells because not all exosomes are created equal.
Right.
So they are kind of the messengers, not the cell itself. We're going to talk about stem cells more in detail during the podcast, but exosomes themselves are just vesicles. They carry nucleic acids, they carry lipids, proteins, and they got a lot of attention in the aesthetic field due to how they are modulating inflammation and healing the skin. And now they, like literally, it's a revolutionary let's say, thing in science, and a lot of products are being launched as exosomes. But as I said, not all exosomes are created equal.
Okay, so I think that's a really good point. And I want to delve into that a little bit later, but I want to know now, like, what is the difference from exosomes and stem cells? So are they derived from one another, or how is that working?
This is a very important question because there's a confusion, especially from patients that are not really aware about the difference. Stem cells themselves are, let's say they're the mother. They release the exosomes. Exosomes are non-living cells. This means that they are only messengers. They do the cell-to-cell communication. They are the end product of stem cells. So in other words, stem cells work through exosomes. And exosomes are the ones that do the healing. And the stem cells are in different tissues. They can exist in adipose tissues. They can even be derived from plants. However, exosomes themselves are the carriers.
Okay.
And this is what we're using in aesthetics.
Yeah. And so exosomes, as you rightly mentioned, can carry peptides and growth factors and RNA. So like all of that really great stuff.
Exactly.
And it's kind of what like the brain, it's telling other cells like, okay, you need a bit more collagen. You need to like be a little bit less inflamed. Okay, right, understood. So you were mentioning that not all exosomes are the same. So what do you mean by that? I know you mentioned plant and human, but can you go into a bit more detail?
So the quality of the exosomes differentiate according to the source, and that's typically the first and most important point. We can compare the sources in the field. Currently, we can see a lot of companies deriving exosomes from plants, which is a totally different language. You know, we're communicating in the same language. Whenever you're talking about plants and humans, it's a totally different questions, like communication. And plants work greatly for antioxidant purposes. You can add them in skincare for a lot of amazing, let's say, functions, but not typically treating the skin. And that's very important. Adipose can be also a source of stem cells, umbilical cord as well. But we, as anti-age MD, we're taking our exosomes from the human bone marrow. And we believe this is the source of healing in the body. Whenever you have a cut or an injury, your human bone marrow, which contains those mesenchymal stem cells, will send those exosomes to the area of injury. This is the natural healing process.
Absolutely.
And when you're applying them topically, this is how you're doing the healing. So the first and most important point is choosing the right source. Second point, you have to know the brand that you're working with. Not all brands are the same. So I'm sure you came across a lot of exosome brands.
Absolutely.
And that's the most common thing now in 2025. I think more than 50 companies are promoting exosomes. So typically speaking, you have to know the brand that you are taking your exosomes from, especially that the level of, let's say, science behind the product that they are using, or, you know, you can come across products that don't even contain exosomes. And that's the most important thing. So you care about quality, you care about source, science, even the size of exosomes themselves. Not all exosomes are in the right size.
That's such an interesting
That's important.
point. So like as a consumer, how do you know?
You have to follow science. That's very simple. You have to know, like if you Google, now everyone is educated. You can just Google the brand and you can go on the website. If you see yourself on a random website that does not exist, then you're not using the right brand.
100%.
So you have to trust the brand, trust the supplier, read more about it, have a lot of evidence. And with anti-age, we have a lot of evidence. You can read the papers, you can see the science behind it. And of course, it's a brand that started with growth factors. So it's not that we just launched biosomes or launched exosomes.
Right.
We started with anti-age MD, the growth factors.
Yeah.
That's very important.
Yeah, absolutely. And I love that you touched on the point of like how you source it from the bone marrow and how that's so rich in like the MSC stem cells, because that's what regenerates, you know, our organs, our skin, everything in the body, and that naturally depletes when we're 25. So it's so fantastic that we have a new way of, of boosting that in our skin.
Exactly.
Okay, I wanted to know the products that we normally have on our mantle have retinol or vitamin C or niacinamide. Do we throw that in the bin now that we have exosomes, or how does that work? Do they work differently? How does that work?
I love this question. It's very important to make a distinction between the three main pillars of medical pillars. We're talking about injectables, we're talking about microneedling, and we're talking about skincare. So what you're talking about is more like skincare products. When you do your professional treatment with microneedling, because typically exosomes are like the delivery system through microneedling. When you do exosomes with microneedling, your professional treatment, you are literally enhancing your skincare results whenever you're using those other things. Those are the backbone of aesthetics.
Yeah.
Your skincare is very important. And even our skincare line that contains biosomes, they are in a different form. Of course, we're talking about a combination of less biosomes in the home care, but it boosts the result of the vitamin C, the retinoids. Even our accelerator contains the plant form of retinol, which is bakuchiol. So it's even enhancing the results even more. And as I said, exosomes or biosomes, they're a treatment. It's considered a treatment. You're not getting a normal, simple mesotherapy injection.
Yeah.
All right. So you're improving the skin from within.
Yeah. And previously when we've spoken, you've said it's a skin investment. And I was like, I love that. I really love that because it really is. It's a great way of thinking about skincare in the future as well. Because, these can be a bit pricey, but they are definitely worth it. It's not something that you'll do one treatment and you'll see the results, and then 1 week later you will not see anything. I can speak from experience. When I did it, I saw the best results like a month later.
This is how it works.
Yeah.
This is how it works. It's very important to educate our clients that you're investing in your skin. That's not just a treatment that you will get glow afterwards and it's going to go away in a week.
Yeah.
You can do mesotherapy injections and you can go ahead and, see the glow after the treatment immediately and it will go away. But with exosomes or biosomes, you're investing in your skin. So after this third session, usually we do 1 month apart, like your procedures. And after the third session, you can typically see your skin improving 6 months after the procedure. So it's not just a treatment that you do now, you're literally investing in your skin.
Love that. And you've mentioned biosomes, so I want to go and delve into that a little bit more. What are biosomes? Explain what's going on.
All right. This is the most recent advancement in regenerative medicine.
Right.
Regenerative medicine is very fast. From PRP to growth factors to exosomes and now biosomes. We have to be realistic. Now we're going towards more lab manufactured or lab manufactured options. This is the safest option at the end of the day. We don't want to call exosomes less safe. They are still safe. We have a lot of cases done, amazing results. But with biosomes now you have extra safety. So what are biosomes? First of all, it's the latest advancement, as I told you, but they are biomimetic exosomes. So what I mean is that they are completely engineered, lab engineered. And when you have an engineered option or a lab manufactured option, you are able to customize it according to your treatment because you can add ingredients. With exosomes, purity is very important. We can talk about it in a bit. You cannot add any ingredient to exosomes because otherwise you can inhibit or cause the exosomes to be not viable anymore. So with biosomes, you have more ability to customize your treatment. You can target it more. You can add ingredients according to the indication that you are treating. For example, if I'm treating pigmentation, I can add tranexamic acid. If I'm treating hair, there's a lot of ingredients that are added, including shikimic acid, azelaic acid, and caffeine. So this way, you can customize your treatment. And it can be more targeted because we can target what proteins and growth factors are in each and every biosome. And that's a very important point because for the aesthetic purpose, we have to have specific proteins that will work on treating the skin. And again, since we're taking our exosomes from the bone marrow, now with biosomes, you can do two sources in the same time because it's not human sourced. We can take it from the umbilical cord and the bone marrow and mimic this function.
That's
so it's an imitation in the end of the day of the exosome function. We can call them exosome-like or lab-manufactured synthetic exosomes.
Okay, I love that. And you mentioned like a really good point about the fact that they're lab-derived, which means that the consistency of what you're getting every single time is going to be the same. Whereas exosomes, again, depending on where you source them from, can vary. And there are a couple of question marks around that. So biosomes really, I think, are going to be the future, as you mentioned.
I agree.
Yeah, definitely. So I also wanted to touch upon the actual mechanism of biosomes. So from my understanding, they're slightly smaller, and so they can penetrate a little bit deeper. Is that true?
Generally speaking, there's a lot of factors that are making biosomes better. So, of course, since it's the latest, let's say, launch from the growth factors, I'm just going to give you an insight. Anti-Ag MD started off with growth factors. We have our Anti-Ag MD line, and then they were researching exosomes for the longest time. And then they launched our Anti-Ag MDX exosomes. When they launched biosomes, they had already a very, let's say, deep research on the science behind exosomes and how they're working. And this is how they did this mimicking action. So they made them better. They made the function better. Biosomes know where they're going. They're more targeted. And it's not only the size. The size, you have more control on the size. You have more control of what's in each and every biosome. That's important.
Yeah.
And as I told you about the source. They even boosted the concentration. With exosomes, you have 5 billion exosomes. With biosomes, now you have 25 billion.
Wow, that's
so
significant.
Exactly. This is the difference, the main difference. We're talking about concentration, a targeted treatment, and as I said, customization. Those are the main factors that make biosomes better. And of course, they're safer at the end of the day.
No, absolutely. And you mentioned about the clinical studies. So can you touch on that a little bit more? Like obviously exosomes maybe have been around for a bit longer, so they have a few more studies. But what are they saying? Like what do they do for the skin? You know, is it collagen boosting? Is it helping with pigmentation? Like what are they saying?
I have to touch down on the importance of the device that you are delivering the treatment with.
Right.
We're going to talk about SkinPen in a bit.
Yeah, and I think that's a really good way to actually, this is a perfect segue. So you can touch on the SkinPen because I think it's incredible.
SkinPen is remarkable. I love SkinPen and I really want to talk about it. I'm really passionate towards the result that we're getting from SkinPen.
Yeah.
So SkinPen is like the baseline. Exosomes, biosomes, growth factors, PRP are the additions. I don't want to, we're still talking about biosomes. I love biosomes. But if you're using the wrong device, you cannot deliver the product properly.
Interesting.
But with biosomes, generally, the studies and what you're expecting from is typically depending on the delivery system. We have a lot of studies on exosomes, that's for sure, because exosomes, as you said, has been in the market for longer. Biosomes as well, there's a lot of research. In our, of course, Anti-Ag is based in California in the USA, and they're doing a lot of studies already on biosomes. So it's still recent. We do have some evidence and case studies, and we're studying the treatments and the results that we're expecting. But safety-wise, now we have the cell safety testing. This is one of the, let's say, the studies that took place in the USA, as well FDA MOCRA, which is a new registration in the USA.
Oh, interesting.
Yes,
that
that's
must
something
be really new.
Exactly. It's not that like the typical FDA, but it's more like, let's say, specific for cosmetic treatments.
Yeah, okay, that's great because I know a lot of brands, I mean, it's
They don't
pretty
have it.
unregulated,
Yeah,
so
yeah.
it's hard to know, but that's a really good first step, I think.
You need to have the boxes. It's still not an injection treatment. It's not an injectable. We still focus on delivering exosomes or biosomes with microneedling therapies.
Yeah.
Either RF microneedling or standard microneedling.
Absolutely. I mean, I think this is a great time to speak about SkinPen because I think it's fantastic, like what it does for your collagen and elastin. But I wanted to speak about what is the SkinPen and how does it differ from typical microneedling?
All right. I love this question.
I could tell her face lit up.
Yeah, I love SkinPen, as I said previously. So this is the thing. Maybe most of our clients in the market and the aesthetic field, they are very used to the word dermapen. All right. But generally speaking, it's microneedling. We need to educate our patients that it's microneedling.
Right.
And with SkinPen, we're kind of moving away from like calling it just standard microneedling. It's skin remodeling treatment, or we're using the SkinPen precision system. This is how we're calling the treatment. And this is what SkinPen is. It's a precision system, as I told you. And you can expect a totally different treatment with SkinPen. That practitioner will love the device. The client will see the difference between normal microneedling and using SkinPen.
Yeah.
So what makes it different? Two things: safety and results. Simple. Safety because you have the FDA approval, and results because only with SkinPen you can get this amazing red mask after your procedure. Super satisfying. And with SkinPen you can get it easily.
Okay, that's so good.
Yeah.
So you were mentioning a couple of statistics before about how much it boosts your collagen and elastin. Do you want to touch upon that?
Yeah, sure. So we can consider that if you're using SkinPen by itself, you can have 80% collagen stimulation. But when you're adding something like exosomes or biosomes, because as I said, what they are doing is that they are doing the cell-to-cell communication, right? And they are boosting this collagen production. They're modulating inflammation. They're enhancing the results. So you can consider a boost of the results up to 500% more. This is the difference. So baseline SkinPen, amazing. But delivering something like biosome and exosomes, you just
Takes
upgrade
it
your
to the
patient.
next level.
Amazing.
Yeah. Okay, fine. So for people who haven't done it before, is there any downtime? Is the procedure painful?
All right. So generally speaking, I can consider it as a comfortable procedure. I've tried it on myself. You tried it.
I tried it as
You tried
well.
it without numbing cream,
Tried
did
it
you?
without numbing cream.
Yeah. So you're going to give us your honest opinion.
Okay.
Of course, it's variable in terms of pain, depending on your pain tolerance. But typically, we don't do super aggressive treatments with SkinPen.
Yeah.
Instead, we focus on just delivering the treatment properly with the right protocol, having this amazing red mask, as I told you, when you are penetrating into the skin. And since it's precise, you cannot consider having any scratches or anything. But typically speaking, I would say it's comfortable.
Yeah.
With numbing cream, it would be even more comfortable, depending on the patient's requirement. If they're super sensitive, we can perhaps add numbing cream.
Yeah.
And the downtime, that's one of the selling points for SkinPen. The downtime is better than other devices.
Interesting.
It's
I didn't know
faster
that.
because of the precision.
Okay.
So you can expect a day after that the redness will shut down. And if you add something like biosomes or exosomes, literally a couple of hours later, your redness would be shut down.
100%, and I can attest to that because I remember I did my treatment and then that evening I went out and it was no issue.
Exactly.
My friend was like, "You did something on your face?" And I was like, "Yeah."
Exactly.
So that's true. And then should people be avoiding doing certain things after, like putting SPF on, putting makeup on? Like, should they just leave their skin after they do the treatment for like a couple of hours, overnight? What do you say?
Typically speaking, your microchannels would be open after using SkinPen. Okay, since your microchannels will be open, typically in the first 6 hours, it would be super, like all of your microchannels would be open. With SkinPen, we can consider up to 2 million microchannels being open in your 20-minute procedure. Approximately, of course. However, during the first 24 hours, it's very critical. We do prefer not to use makeup, of course, after your procedure, since your microchannels are open. Just stick to using your gel, your lift gel that comes with a SkinPen. You can hydrate your skin. And after 24 hours, you can go back to your natural life. And of course, always wear your SPF, of course.
I know, we love SPF here, we do. A little bit off topic, but there are so many treatments on the market now. PRP is a really popular one, for example. So how does doing the SkinPen, for example, differ from PRP?
So we can compare biosomes and PRP. As I said in the beginning, the things that were launched or the treatments that were launched in the market in the aesthetic field were starting from PRP, mesotherapy. We went to growth factors, exosomes, and biosomes. So PRP is still a very stable treatment there. A lot of people love PRP. I love PRP, but you have to have the right patient to extract the blood from. So it depends completely on the blood quality.
Right.
So your age, your health, all of these points play a very important role. And this is why I would say biosomes are better than PRP, confidently. But PRP is, it's from the longest time there, and it works in a specific pathway. Like, for example, for the hair, I would combine PRP if my patient's healthy with biosome hair because they're working different pathways and you're treating your patient from more than one pathway. So all of the treatments in the market are there to be combined. I believe in combination, and it would be really nice to add it into your treatments. But as I said, your biosomes are more trusted because you know exactly the concentration in each and every vial.
Yeah.
It's different than PRP.
You know it's pure, you know it's not diluted, you've got control over it. Love that.
And PRP, since we opened this topic, I do have a brand of PRP. We have the Sinless PRP, previously called Eclipse. But our PRP is, you know, it's very important to take the PRP from a trusted brand because such as, we're talking about biosomes, we talked about how important it is to choose your right brand. With PRP, the tube makes a difference, the type of, you know, how the separation is taking place. All of these points are very important. So again, not all PRPs are equal.
This seems to be like the running
Yeah, that's my motto.
Okay, fine. So now, coming to the future, I mean, it's so hard to tell because I think things are moving so quickly, but what do you think the future is going to be when it comes to like exosomes and biosomes and stem cells?
I typically think that we are going to move away from human-derived options, even though we are getting amazing results from the human-derived options. We might go towards the lab-manufactured options more.
I agree.
And that's going to be more, let's say, it makes sense to go towards this option since it's a better option. But we're not leaving them in the past. We still have our growth factors and we're still selling them. I love our growth factors. I love the anti-age MD brightening. And I still have amazing sales for the anti-age MD brightening. But some things are just better than things. And we're very fast, as you said. And specifically the aesthetic field, we're running. Like, it's like a roller coaster. We're trying to catch it.
Yeah. Okay, fine. Well, it's been such a pleasure having you on.
Thank you.
Thank you for coming in. My very last question is, at Scintillia, we believe that beauty is like a spark from within. So is there a product you go for or a treatment that you go for to ignite that spark within you?
Like generally from my line, from anti-age, or generally?
Just generally in your life. Is there a product that you're like, not living without that, or a treatment you're like, I'm not living without that?
Like, I think I'm just obsessed with anti-age, so I love our anti-age brightener.
It is great.
Yeah.
It's
great. Not the professional treatment, the home care. You didn't try it yet, but I'm going to totally send it to you.
Oh yeah, I would love to try that.
Yeah.
Okay, cool. I'm very excited.
Perfect.
Well, it was such a pleasure having you.
Thank you so much.
Honestly, I feel like every single time I speak to you, I learn so much. And I'm sure everyone today did as well.
I'm so glad to be here.
Inshallah.
Thank you so much.
Inshallah, we'll welcome you back very soon.